everyone. Today we are going to talk about lip and tongue ties. So now this is a topic that is super close to my heart and I have a lot of knowledge with in my own experience with my first son because he ended up with a lip and tongue tie. So a little quick backstory. He was born early, 3 weeks. He never breastfed in the hospital. And I couldn't even get him latched. So I saw one lactation consultant in the hospital and she couldn't help me get him latched. So then I went through my pediatrician's office and I saw another lactation consultant that was through the pediatrician's office. And she finally was able to give me a nipple shield and we were able to get my son on with a nipple shield. So then I knew that it was a tool and that I needed to get rid of it. So I tried to latch him without it. And if I was trying to get him latched without it, it was like this toe curling nipple pain. Like my nipples were like sore red, bleeding blisters. It was horrible. And I was like, breastfeeding should not be this painful. Like it was absolutely killing me, not knowing what was the problem. And finally, I went on a last swim and I said I was gonna do everything to be successful with breastfeeding. And I'm so glad I didn't give up because I went and I looked around my area and there was another private lactation consultant and she was phenomenal and I paid for her out of pocket because my insurance didn't cover her because she was out of network. So anyways, I went and saw her and immediately she did a mouth assessment on him after trying to latch and she said he had a severe lip and tongue tie. So long story long, we end up going to get it fixed and I'm going to share kind of all those things with you of different options, both invasive and non-invasive ways that you can work with a tongue tie with breastfeeding. Okay, so that's a little bit about my backstory. In the end, after 5 weeks old, he ended up breastfeeding for the first time on bare breast without any pain and he nursed for a full 13 months. Okay, so lip tie, what is it? Oh, so the lip. Oh, lip tie. It's that little piece. Okay, so you know when your lip, it's this little piece of skin, okay? When you lift up your lip right here, so you can see that little piece right here on the gum. Okay, so now for babies, well, newborns especially, if it's too tight and you're trying to like lift up, it kind of gets really tight. So that little piece of skin can actually go all the way around your gums and onto the other side. And there's 4 different stages with lip tie. Okay, so there's 4 different stages. And I'm gonna share pictures below from Dr. Cutlow. He was the pediatric dentist that actually worked on my son's mouth and he's been doing research on lip and tongue ties for years and actually wrote a book on it and I've learned so much through him. And there's some different stages. So I'm pretty sure my son Carter had a stage 2 or stage 3. And now the tongue tie is the trickier one. So when you have your tongue and it's lifted up, so say this is the roof of the mouth, this is the lips. It's this little piece right here. It's right underneath, okay? So now opposite, it's this. See that piece underneath my tongue? This also has 4 stages of severity too. So obviously stage 1 is good, all the way to stage 4 is bad. Okay, so that's how Dr. Cutlow rates and stages these lip and tongue ties. Now, there's something that you also need to do with tongue ties. There's 2 types now. So you branch off and you have anterior, which means the front of the tongue. And then you have number 2, which is posterior, which is the back of the tongue. Okay, now anterior is more obvious. It's like right there in your face and you can't miss it. If you've ever seen any of those babies that it looks like when they try to stick out their tongue, they can't stick it out very far, or they have like a heart-shaped tongue, because that piece of skin, it's called a frenulum. This is called a frenulum. Frenulum is is actually so tight that it's going all the way towards the front tip of the tongue, and it makes like a heart shape. So those ones definitely have to be clipped because there's no way you're gonna breastfeed with them. Posterior, these ones are tricky. Okay, this is what my son had. So he didn't have this obvious piece of frenulum or skin that was going down. When he lifted up his tongue, everything looked pretty okay. So there's some things that I'm going to show you that you can look at for your baby, to what to look at. But definitely those posterior tongue ties are super tricky. Okay, and then the one major thing that tongue ties do is they limit the tongue's efficiency and movement. And movement. Sorry, my handwriting is not great on the whiteboard. All right, so this is mostly for tongue ties. They limit the tongue's efficiency and movement. Okay, so the one thing about tongue ties is that, so it's not about, oh, sorry, I have hair in my mouth. So it's not about the tongue going past the gums. Now, I hear this all the time with pediatricians, neonatologists that I work with, and I literally just want to shake them sometimes because I'm like, that's not what it is. Like, you have not done research. You don't see the moms at the breast side. I am there with them breastfeeding. I'm seeing that latch from the outside looks good, but then when that baby comes off, that nipple is like reddened, raw, or I see the mom's grimace on her face when she's trying to latch, and you know something is wrong on the inside. That's the thing. Sometimes a latch might look great from the outside, but inside there's an anatomy issue, okay? That's out of your control. So just let that go. These are coming up all the time and they're just undiagnosed. So I'm just giving you the tools and the education so you can be more aware of it and check your own baby, because it's super simple. And even as a nurse, I can't technically diagnose any babies, but I can definitely do an assessment and tell you, yep, pretty much is a tongue or lip tie. Okay, but these are simple things that you can do at home. But those tongue ties are definitely very tricky to find and to see what's going on. So it's not about that tongue going out past the gums, okay? I can stick my tongue out, right? Pretty far, right? Some people, even with tongue ties, can stick their tongue out pretty far. It's not about that. It's actually about the tongue flowing up to the roof of the mouth it's about the tongue like pushing up the breast. So if this is the breast, oh, hey, look at, okay, this is the breast and it's in baby's mouth. This is their tongue. You want their tongue to, it compresses the breast up to the roof of the mouth, and then when it comes down, all that milk, that colostrum squirts into the back of their mouth and they swallow. So it's about that tongue compressing that breast tissue up towards the roof of the mouth, and that's what compresses and squeezes out the colostrum. Then when they release, it flows out, okay? The tongue doesn't go this way in a baby's mouth. The tongue goes up and down. The whole point is to compress that breast tissue. That's why you want them deep on the breast, so their tongue, if it's my thumb is their tongue, right? It's doing this wave movement. It literally, there's been, I will post links below with Dr. Cutlow and some of his research. I'm really planning I'm getting up the courage to ask him to do an interview because I think he will be phenomenal. But he has some amazing resources and videos that you can watch on YouTube that are for free. I can't do them myself, but I can tell you they are phenomenal and you can learn a lot from them. And you don't see that tongue going in and out when somebody's breastfeeding. That baby's tongue is going up and down. There's been videos of ultrasound where it's literally the tongue is flowing like this. And if you got a tongue tie that's holding that tongue down and it's really tight and it's towards the back of the tongue, those posteriors, people look at it and they're like, no, it's fine. But that tongue doesn't have any movement, okay? If the baby's latched, right, and this is their tongue, and it can't do anything. So it's not efficient and it has decreased movement. So therefore, you're gonna have a decreased supply, okay? So you know what? I'm just gonna erase this. Yeah, let's talk about some symptoms. And again, Dr. Cutlow he can show you stages of all the different variations of tongue and lip ties. It's really cool how he staged them, and you can easily see. Okay, so some symptoms. Number 1, nipple pain. It's one of the first ones. Nipple pain, incorrect shape of nipple after breastfeeding. Shape of nipple after BF is breastfeeding. Okay, so nipple pain. Okay, you can latch that baby on no matter how deep the latch. And this was Carter. I had watched videos after videos, and I made sure I was in football, had the deepest, perfect latch from the outside, yet I was still having this toe curling pain, and I was so frustrated. I was so confused because I was like, why? I was like, I've done some of my research on breastfeeding. I know if you're doing it the right way, it shouldn't be this painful. And I was really frustrated by it, and I just continued doing my research and continued asking questions and seeking out more lactation consultants, because just like anything, there's some good lactation consultants, there's some bad ones. The ones the first 2 that I saw, they didn't really care. You know, they didn't really listen to me, and they didn't really try and find the root cause of the issue, and that was really frustrating. It was finally that 3rd one where I paid out of pocket, and she literally dove right in, gave me so many tips and tricks, gave me an answer to my problems, gave me a solution, and that's what it's about. That's what I want to do for you if you find that your baby has a lip and tongue tie. Number 3, this is a big one, continuously nursing. Okay, so now what I mean by that is this is a tricky one that if your milk isn't in yet, it's hard to see. However, you're really gonna see this once your milk is in. If your milk is in, you're really gonna see this one. Basically, your baby's going to nurse and nurse and nurse and nurse. Could be nursing for like an hour, and then all of a sudden you lay them down, it's been like 15 minutes and they're screaming their head off again. And you're just looking at them like, I just fed you. You know, like they can't be cluster feeding that often when your milk is in and they're a couple weeks old. That shouldn't really be happening every feeding. This is what was happening with Carter, is I just kept nursing him. And again, I was using the nipple shield because it was too painful without it. And I was so frustrated because I was like, I don't understand. I was like, my milk is in. I was, you know, I had pumped, I had tons of extra, and I was like, I don't understand why he's still nursing like this and he's not satisfied, because it's of that tongue efficiency. That tongue is still doing the job, but it's not as efficient. So he has to work longer and harder to take the milk out of the breast, okay? And this is where you might see some babies, if you have an undiagnosed lip and tongue, mostly tongue tie, and it's like a couple months down the road and all of a sudden you notice like a tank in your supply and your baby just starts refusing the breast out of nowhere, think tongue tie. Think undiagnosed posterior tongue tie that somebody overlooked, because this is what happens. Those babies get so frustrated, so angry at the breast that they are trying and trying and trying, and finally they just give up. They're like, I am so exhausted trying to work at getting this milk out, and it's not working for me, and I'm done. And this is where you'll have babies start refusing the breast. And I actually helped a woman recently in Australia with this, and my heart just broke for her. She was 6 months postpartum, and those exact things happened to her. She noticed a decrease in her supply. Her baby was refusing the breast, and she wasn't sure what was going on. And that's exactly what her baby had. Her little girl had a lip and tongue tie that was undiagnosed, and it wasn't super painful. So you're not gonna have all 3 of these. There's a couple more, let me write them down. Excessive continuous nursing. Hold on. Oh, delay of your milk supply coming in. Delay milk supply or decreased / decreased supply. So kind of there's 2 variations of this. If you're trying to get your milk supply in, you're not doing additional things like pumping or hand expressing after, and you don't think your baby has a lip and tongue tie, and it's like day 5, day 6, day 7, and your milk finally comes in, think about that tongue efficiency. Think about something else is going on inside with your baby's anatomy. But then also, if they do okay in the beginning, but then in the next couple months you find that your supply tanks, that could be a definite reason. I think there was one more. I'm just trying to think about it for myself. One. Nipple pain, creep shit of nipple. Oh, they can have a really shallow latch. That's what it is. Okay, that's the last one. Shallow latch. Okay, that tongue is so restricting that they just barely want to open the mouth and they get barely on the breast. So you can see you want that baby have like a big mouth, like go deep and then up and over and get a good chunk of breast tissue. Now, if you have a baby with a tongue tie, they might get super narrow because they just don't have efficiency of the tongue, and they're just going to do these little waves instead of these big waves, kind of like that. So that is definitely another symptom of the tongue tie. There's kind of another symptom of lip tie is also, this isn't really with tongue tie, this is more with lip, is little lip blisters. Now, these aren't like lip blisters like you and I know that are like filled with fluid, you know, like when you've been raking, you know, get those callus blisters on your hand and then they fill with fluid and they pop. They're not like that. They're usually symmetrical blisters on the lips, and they look kind of clearish, whitish. I will post some pictures below kind of what to look for. Evie, my last daughter, had this because she did have a pretty good lip tie, but she grew out of it and basically she was holding on a lot with her lips. So you'll see those little lip blisters, and then also they're unable to flip their upper lip up. Unable to flip lip. That's funny. Flip lip. Okay, so that top lip, if they have a really strong, tight lip tie, their lip can kind of be like white and pulling and it's super tight. And when they're latched, you can't get that nice, loose, flanged lip to create that negative pressure seal. So that can really be another symptom of that. Okay, so that is kind of what lip and tongue ties are. There's 4 stages for each one. I'm gonna post those pictures below so you can kind of look at those. And these are the definite symptoms that you wanna watch out for. So these ones are definitely more tongue related. And then these ones are lips. So nipple pain, incorrect shape of the nipple after breastfeeding, kind of like a tube of lipstick. It's really compressed and red, continuously nursing, delayed milk supply or decrease in supply, and baby can have a shallow latch. The lip is those little lip blisters and unable to flip that lip up. All right, so overall, the main thing is that tongue is not efficient. The movement is decreased. That means it's also gonna have a huge effect on your supply. All right, so,
Is Dad in here?
No. All right, so I'm going to be making the next video about how to assess those lip and tongue ties. And then I'll do a third video talking to you exactly how you can fix it, both invasively and non-invasively.